Okay, so would you readily agree with me that the chronic waist pain of 6 months, 1 year, 2 years, 5 years that you have after undergoing a cesarean section, especially if your anesthesia was spinal anesthesia, was not due to that spinal anesthesia that was administered before your cesarean section? Let me list 2 or 3 very, very common causes of that chronic lower back or waist pain that you have after undergoing a cesarean section. Number 1 is that your womb and the developing baby continues to stretch as the womb gets bigger and your baby continues to get bigger and develop. They continue to stretch your back ligaments and muscles. This goes on for a period of close to 9 months. And now you've had 1, 2, 3, 4 children. So it's a repeated cycle of stretching of back ligaments and muscles that were hitherto, they've been very, very, relaxed, passive over time. That is 1. Number 2 is your sleeping posture, especially as your baby gets big during pregnancy. Do you have a good sleeping posture? Because we would usually advise that you sleep on your side as your baby advances, as your pregnancy advances. Number 3, that is very, very, very key, is the posture you take to sit when nursing your baby, when breastfeeding your baby. Obstetricians, neonatologists, pediatricians will tell you that you should put baby to breast, not giving breast to baby. When you put baby to breast, you sit relaxed and you bring your baby to your breast. But when you give breast to baby, you're just sitting that way and you bend over. Now, how many months, how many years do you breastfeed each of your baby for? 6 months, 12 months, 14 months, 15 months, 18 months. Repeated cycle of nursing 1, 2, 3, 4 children. In some cases, more. In some cases, your pregnancy even gives you a set of twins or a set of triplets. The mistake most of our mothers make is to give breast to baby instead of putting baby to breasts. It gives you a lot of tension on your lower back. These are 3 of the very, very common reasons why you experience chronic waist pain or chronic lower back pain as a woman that has delivered. And by the time you are going to sample other women that has delivered, you will realize that there are women who had spinal anesthesia for their cesarean section but never experienced this chronic waist pain that you experience, or it's just for a very, very short period. You would also realize that there are women who has probably never even given birth, but they've had a myomectomy, they had a spinal anesthesia, and they never complain of this lower back pain. You will see men that have had prostatectomies, bladder surgeries, lower limb surgeries, women that have had the same thing, ovarian cystectomy, ectopic pregnancies, who never complained about this chronic lower back pain. You will see women that have had all of their babies delivered naturally, complaining of this same lower back pain. It is an indication that stand alone, spinal anesthesia is not the reason for the chronic waist pain or lower back pain that you experience.